Hello everyone, I am a professional esthetician and cosmetologist. Today I will give you researched guidance about trendy topic non-surgical nose job, rhinoplasty, from how it works to benefits, costs, dermatologist recommendations, good candidates and more. So watch the complete video till end, and subscribe not to miss latest updates. Section 1. What exactly is a non-surgical nose job? A non-surgical nose job, medically known as non-surgical rhinoplasty or commonly called a liquid nose job, is an innovative cosmetic procedure that uses special injectable fillers to reshape and refine the nose appearance, without any surgery, scalpels, or lengthy recovery time. Unlike traditional rhinoplasty that requires breaking bones, cutting cartilage, and months of healing, this approach simply involves strategic injections of FDA-approved dermal fillers to smooth out bumps or irregularities, lift a drooping nasal tip, correct minor asymmetries, improve overall facial balance. Section 2. How does non-surgical rhinoplasty work? Instead of surgery, a doctor uses special fillers, like Juvederm or Restylane, to reshape the nose by adding volume in the right places. What can it fix? It can smooth a bump. Filler is injected above and below the bump to make the nose look straighter. It can lift a droopy tip. Adding a little filler under the tip gives a slight lift. It can correct small asymmetries. If one side looks uneven, filler can balance it out. It can improve nostril shape. Minor adjustments can make nostrils look more even. What it cannot do? It cannot make a big nose smaller. Fillers only add volume, not reduce it. It cannot fix breathing problems, requires surgery. It cannot last forever, results fade over time. Section 3. Which fillers are used? Non-surgical rhinoplasty primarily utilizes hyaluronic acid, HA, based dermal fillers, which are favored for their safety profile, natural-looking results, and reversibility. The most commonly used fillers include Restylane Lift, Juvederm Voluma, and Bellotero Balance, each selected based on the specific nasal concerns being addressed. Restylane Lift and Perlane are thicker formulations ideal for adding structural support to the nasal bridge or camouflaging dorsal humps, while Juvederm Voluma provides exceptional lift and volume for drooping nasal tips. Bellotero Balance, with its smooth consistency, is often chosen for more subtle refinements and delicate areas where seamless blending is crucial. These HA fillers are preferred because they integrate naturally with the skin, provide predictable results, and can be dissolved with hyaluronidase if adjustments are needed. It's just important to note that permanent fillers like silicone or calcium hydroxylapatite-based products are avoided in the nose due to their higher risk of complications and inability to be reversed. The choice of filler ultimately depends on the patient's anatomy, desired outcome, and the injector's expertise, making a thorough consultation essential for optimal results. Section 4. Non-surgical procedure step by step. The non-surgical rhinoplasty procedure is a meticulously planned process that begins with an in-depth consultation to assess the patient's chest nasal anatomy and discuss their aesthetic goals. During the treatment session, the area is first cleansed, and a topical numbing cream or local anesthetic is applied to ensure comfort. Using either a fine needle or a blunt-tipped cannula, the provider strategically injects small amounts of filler into predetermined areas of the nose, such as along the dorsal hump to create a smoother profile or beneath the tip to provide lift. Each injection is carefully placed to avoid blood vessels and ensure even distribution of the product. As the filler is administered, the provider gently massages the area to mold it into the desired shape and prevent irregularities. The entire process typically takes 15 to 30 minutes, and patients can see immediate results, though final outcomes become apparent once any initial swelling subsides after about 1 to 2 weeks. Post-procedure, patients receive specific aftercare instructions to optimize healing and maintain results, making this an efficient and transformative treatment with minimal downtime. Section 5. Recovery and aftercare. What to expect after your procedure. Immediately following your non-surgical nose job, you may experience mild swelling, redness, or slight bruising around the injection sites. This is completely normal and typically subsides within 24 to 48 hours. Some patients notice that their nose appears slightly fuller or uneven at first, but this is just temporary due to the filler settling and any residual swelling. To ensure optimal results and minimize complications, it's important to follow proper aftercare. Avoid wearing glasses, touching, or applying pressure to your nose for at least 48 hours, as this could displace the filler. Strenuous exercise, excessive heat, like saunas or hot showers, and alcohol should also be avoided for the first 24 hours to reduce swelling. Sleeping slightly elevated on your back the first night can help prevent additional fluid retention. Most patients feel comfortable returning to their daily activities immediately, though we recommend scheduling your treatment at least a week before any major events to allow for full settling of results. Section 6. How long do results last? Understanding longevity and maintenance. The duration of your non-surgical rhinoplasty results depends on several factors, including the type of filler used, your metabolism, and lifestyle habits. On average, hyaluronic acid-based fillers like Juvederm or Restylane last between 12 to 18 months before gradually breaking down. Patients with faster metabolisms may notice their results fading sooner, while those who maintain a stable weight and avoid excessive sun exposure may enjoy longer-lasting effects. Unlike surgical rhinoplasty, which provides permanent changes, non-surgical adjustments require maintenance. Many patients opt for touch-up treatments every 12 to 15 months to preserve their desired shape. The upside? As your face naturally ages, you can tweak your results to maintain harmony with your other facial features, something surgery doesn't easily allow. Section 7. Potential risks and side effects, what you should know. While non-surgical rhinoplasty is considered low risk compared to traditional surgery, it's not without possible side effects. The most common temporary reactions include swelling, tenderness, and minor bruising, which usually resolve within a week. In rare cases, patients may develop small lumps or asymmetries, which can often be massaged out or adjusted by your provider. More serious but extremely uncommon risks include vascular complications, where filler inadvertently blocks a blood vessel. This is why choosing an experienced, board-certified injector is critical. Allergic reactions to hyaluronic acid fillers are exceedingly rare, but if you have a history of severe allergies, discuss this with your provider beforehand. The good news? Because HA fillers are reversible, any undesired effects can be quickly dissolved with an enzyme called hyaluronidase, offering an extra layer of safety and peace of mind. Section 8. Pain level, what to expect. Most patients describe the discomfort as mild, comparable to a quick pinch or pressure. Providers use numbing cream or ice to minimize sensation, and hyaluronic acid fillers often contain lidocaine for added comfort. While pain tolerance varies, the procedure is generally well tolerated, with any brief discomfort fading immediately after injections. Some tenderness or slight throbbing may occur afterward, but it typically resolves within hours. Section 9. Dermatologist's recommendations. According to Dr. Sarah Chen, board-certified dermatologist, NYC, in my practice, I've seen non-surgical rhinoplasty transform patients' confidence in just one lunchtime procedure. When performed correctly with hyaluronic acid fillers, it's one of the most satisfying subtle enhancements we can offer. Always choose an injector with extensive nasal anatomy knowledge. The instant gratification is appealing, but I always remind them maintenance is needed every 12 to 18 months. Section 10. Cost comparison, non-surgical versus surgical rhinoplasty. One of the biggest advantages of non-surgical rhinoplasty is its affordability compared to surgical alternatives. While a traditional rhinoplasty can cost anywhere from $1,500 to $15,000 or more, depending on complexity and surgeon expertise, a liquid nose job typically ranges between $600 to $2,500 per session. However, it's important to factor in maintenance costs, since results aren't permanent. You may need repeat treatments every year or so to maintain your look. Surgical rhinoplasty, while more expensive upfront, is a one-time investment with permanent results. The choice between the two often comes down to your goals. If you're seeking subtle refinements with no downtime, filler is an excellent option. But if you require significant reshaping or functional corrections, like fixing a deviated septum, surgery remains the gold standard. What is right for you? A non-surgical nose job is perfect for subtle refinements like smoothing bumps or lifting tips without surgery. It's quick, reversible, and requires no downtime, with results lasting 1 to 2 years. Ideal for those wanting minor changes or to test a new look. It won't reduce nose size or fix breathing issues, which require surgery. For safe, natural results, always choose an experienced injector. If you're ready for a subtle enhancement, consult a trusted provider to explore your options. Like and share this video for more trendy beauty treatments. Thanks for watching.